Well, hundreds of thousands of people in our area live in food deserts. There are low-income areas without large supermarkets and lacking healthy, affordable food.
Yeah, generally they're in Black and Hispanic neighborhoods, including the South Bronx, Bed-Stuy, and parts of Harlem and Staten Island. Craig Treadway has a look at the issue in our Create Equal series.
There is a staunch inequality issue when it comes to access to foods.
Latoya Metters knows food deserts. She grew up in one in Staten Island.
The thing about living in a food desert is lack of access to fresh, affordable groceries, lack of access to culturally relevant food, but also the amount of grocery store options that you have when you live in these areas.
And there are real consequences.
Access to fresh foods in particular is related to obesity and to other risk factors such as hypertension and diabetes, which we know have consequences for cardiovascular disease.
There are very limited options as far as healthy alternatives.
Fabian Wander works in the South Bronx, in the heart of a longtime food desert. He's director of the Health and Wellness Center at Ostos Community College. He believes there's an impact on the students from food deserts who may eat fast food nearby.
It probably impacts their ability to pay attention, for them to focus.
Think about when you go into a corner bodega. Think about the options that are inside that store. Potato chips, high fructose corn syrup drinks, and everything that is not good for the body.
But why aren't there full-service supermarkets providing fresh produce and other nutritious items?
They don't have full-service supermarkets because they can't make money there. That's the bottom line.
Phil Lempert is known as the supermarket guru. He's an analyst, consultant, author, and podcaster. He says major supermarkets face a slew of costs that keep them out of food deserts. Among them, maintenance, security, and crime. Another issue, food desert residents often lack cars, so their grocery purchases may be smaller.
The problem is when it comes to produce that people who are in food deserts typically don't eat produce.
There are efforts to change things.
We focus on health and wellness cooking. We focus on providing access to people.
Latoya Metters expanded her Brownsville catering business, Collective Fare, during the pandemic to become a cafe and provide outreach.
I think the best thing right now is the conversations that we are having and the awareness that we are all realizing.
Ostos has added a food studies program and is bringing fresh food to campus.
A lot of our students are also parents. I can definitely say I've seen an impact. The student parents in our program talk about how they, introduce newer foods to their children.
But supermarket guru Phil Lempert says it can take a long time to change food tastes.
What we're going to have to rely on are government programs that are going to help these supermarkets be able to stay in a food desert and make some money while they're there.
That could help food deserts bloom and spread the benefit of healthy food. Latoya Metters felt it when her mom brought her to supermarkets as a child.
We would go into these stores and I would see like all of these different items and it's like, what's that? And what are these? Like, I've never seen these before.